Jerome, and as you say, a really exciting afternoon and the culmination of 9 months, really hard work to produce a report that looks at technology for our ageing population. And as you say, we're joined both by speakers this afternoon, our erstwhile chair, Professor Roy Sandbach, our funders, Dunhill Medical Trust, and also panel members who contributed both time, intelligence and insights into helping us shape this report that our senior research officer, Lo Speech, skillfully crafted. And I'm sure anybody who's had a chance to have a look will agree that she's done a fabulous job. Just by way of background, nearly 12, 13 years ago, Lord Best opened the HAPPI Inquiry, the Housing Our Ageing Population Panel for Innovation. And that set out 10 key qualitative standards to look at design for an ageing population. And I'm sure Andy Von Bradsky will join us, as I know he and his colleagues were very much part of that HAPPI process. But one of those 10 principles included being care ready. And in that terminology was a throwaway line which really looked at new and emerging technologies without at that time really understanding it. And what this inquiry is really sought to do is unpick that and come up with a suite of ideas and insights to help build a new framework that can mirror some of those HAPPI design criteria, but specifically looking at technology. I'm not going to say much more about that because otherwise I'll be stealing Roy, Sue and others' thunder, but it really played a really big part in shaping how we took this inquiry on and the report and what we'd like to do next. So we've got a great lineup for you, and I'm really pleased to hand over to Sue Kaye, the Chief Exec of Dunhill Medical Trust, and Professor Roy Sandbach to formally launch the report. So over to you both.
Thank you very much, Jeremy, for that very warm introduction. Hello, everyone. I'm delighted so many people were able to join us. For those of you who don't know too much about Dunhill, our mission has long been focused on funding remarkable science. But we also want to support the radical social change that we'll all need to see if we're going to secure a healthier older age for us all. So in launching our new strategic framework, it was about this time last year, we thought hard about how the research and evidence that we funded could be used much more effectively to impact policy and practice and really make a difference to people's lives. We've been working for the HousingLIN for some time now, so we already had a go-to partner who really share this key value of evidence-informed practice and change. And Jeremy and the team called upon their extensive battery of knowledge and their formidable network to create a panel of industry leaders that encompassed the LGA and its members, the MHCLG, the TSA and its members, ADAS and its members, right to the Queen of Sweden's charity, Sivia Hemmet. We had a number of panel hearings and 4 regional events in which we heard from various parts of the sector on good innovative practice that was already happening. And despite the fact that we weren't able to meet face to face, those events were rich in their content, inspiring and a real pleasure to be part of at a time when actually things were really quite hard going. We also received written submissions and ensured we were closely linked with 3 other commissions that you'll see here. One of which I'll come to in a moment, but they all have complementary objectives. We're really delighted with the results. It's a great example, I think, of the kind of support and initiatives we were hoping would emerge from our plans. And indeed, at this point, as I said, I'd like to highlight that we're looking forward to the publication of another report in a couple of weeks' time that will reference this report. And that's from the Commission on the Role of Housing in the Future of Care and Support. As I said, these 2 initiatives really are very complementary. We've seen interest from the relevant departments of state, and we're working to engage them further in making the changes that need to be made. But if COVID has taught us nothing else, it's not to wait for departments of state to get involved. I urge everyone here to make a start, to get going, use whatever influence you have, be it in procurement, planning, commissioning, education, training, product or service design, or frankly, your own personal buying power or vote to embrace the principles that this report recommends. Please also reflect on the fact that the best use of technology will require a multi-agency approach, and that means collaboration, not competition, to achieve the very best outcomes for users. I think that we've seen a real will to collaborate amongst all of those who've contributed to creating this report. It's been a real joy in that regard. But when we were planning this event and swapping updates on the interest and engagement we've had in this work, we were reflecting on the serendipity of the timing. It seems there's a real hunger to get going on making change. And I hope that you're starting to get a sense of how excited we are about the outcome from this initial phase of work. I'm indebted to Roy and to Jeremy, and particularly to Lois and all of the team for their support, their sense making, and the sheer energy and passion, and the will to seek and surface some great evidence examples of good practice wherever they were found. But most importantly, wisdom, humour, and a laser-like focus on keeping the user perspective at the centre. So I won't say much more right now, but I want to hand over to Roy, who's going to tell you all about what we found and what we've proposed. So over to you, Roy.
Thanks very much, Sue. You know, as the number of people who are engaged with this, the numbers going up, I'm getting more and more nervous. And so you'll all have to bear with me over the next 10 to 15 minutes as I sort of try to bring to life for you the kind of lessons that I've learned as someone who is rather on the boundaries of the real work that's taking place in the context of technology, care, housing, and the broader sector. I'll give you some thoughts that have been important to me over the last 6 months. Secondly, I'll take you through a little bit of what is in the report, and I'll sort of give you some signposts to the things that I think are absolutely cool. Now, I'd like to thank you all for taking time to listen to what we've learned. There's nothing more important than insight in developing great strategic direction. It's something that, you know, I've learned over many, many years working in consumer-oriented businesses. And I should welcome you, by the way, to my mother's dining room. I'm here by accident more than anything else, but this is a great place for me to be, to look around and see how much opportunity we've really got. Now, frankly, you could argue that I've got both bad news and good news to tell you, but in reality, there's a challenge and an opportunity. I look around this house, which I grew up in, and there isn't a lot of technology in here other than washing machine and a microwave and a fridge. And she's 93, she lives here alone. She's got plenty of people around her, but there isn't any enabling technology that will keep her life good, give us some guidance on how she's doing, and prevent her arguably from catastrophic problems that might happen that would then lead to all sorts of issues for herself and for us, the family. So what am I really saying? I'm saying an opportunity. However, this is such a complex, fragmented, cross-sectoral area with so many different interest groups, and there's so much to do. So I think of this as that we're at the foothills. We've got the crampons, we've got the ropes, we've got a mountain to climb, but if we can climb it, then I think we'll be able to take people, whoever they might be, from a position where technology really isn't engaged in their lives to make their lives better for longer, and turn it into a situation where technology enables their lives to be better and longer. Now, the TAPPI inquiry has taught me that there are some really, really great things that we can harness in order for all of this to happen. I mean, first of all, it's remarkable how much skill and commitment is around in every aspect of the engagement of groups and individuals with the opportunities to put technology as an enabler into the lives of ordinary people, whoever they might be. That's great. In addition, enabling technology has reached that point of almost a tipping point, if you like, in terms of its integration into people's lives through smartphones and through Alexas and other things. And we're in a position where we might be able to find routes by which easy access and easy use of technology can make really great strides at intervening and penetrating the population at large. Now's the time to do it. Let me say some things now about what we've learned in the TAPPI inquiry itself. And I'm going to go back a step, and because there's a word in TAPPI that many people use and lots of people don't really understand well, and that's innovation. And that's the I. In my head, this is something that I've been part of for many years. Innovation is matching what's needed with what's possible. Let's not take it much more, that's a superficial look at it, but nevertheless, it's not bad to think through what's needed and what's possible as being at the core of what we've been doing in terms of looking at opportunity in this space. It requires two things. It requires dialogue between people with needs, whoever they might be, and people with opportunities to provide problem solutions. So that dialogue is absolutely crucial. But there's another thing to do with innovation that's important, and that is another D, it's delivery. And one of the issues that we face is that while there's a lot of dialogue going on, and there are a lot of, if you like, relatively small scale applications that exist in the context of innovative practice, what we've not done is driven that to delivery on a great big scale. And what we've tried to do with TAPPI is to develop a set of principles that, the way I think of it, is that we want to create a conversation, the right conversation, every time care and support for individuals is discussed. We want that conversation to include these principles almost as a sort of a starting point for doing the right thing. And here they are. These are the 10 TAPPI principles. And you know what I'd really like? My wish is that these principles are on a piece of paper, they're on the desk in everybody's office, everywhere in the care, technology, local authority environment, so that we can keep at the front of mind some of the things which we've learned in TAPPI that are central to great practice. Let me just put a couple out. Person-centered. It's a remarkable thing, of course, as you get older, that our world becomes a bit more heterogeneous. In fact, my experience at the age of 67 is quite different to individuals' experiences at my age. We've all been through so many different things. It means that it's much more difficult to provide sort of bundled responses for large groups of people. That means we've got to be more individually personalized, person and person-centric. We've almost got to do another TAPPI principle, co-produce with people. There's absolutely no good in defining what's possible if you don't really know what's needed. So the conversations around that are absolutely vital. And if I could just wish for something, it would be that these principles are on everybody's desk from tomorrow, and that they have an effect of creating a conversation. The second thing that we've learned in TAPPI is that there's magnificent best practice in all sorts of wonderful environments. And when you read the report, and I hope you keep the report and just flick through some of these wonderful examples from our expert witnesses, but equally from across the whole environment, you'll see best practice that can be replicated and reapplied. I'm not sure that there's enough awareness of great best practice across either the country or the world. And I think we have an opportunity to change that. And I'm actually enrolling you to that sense of best practice change. And the final thing is that we've learned that the pace of change is very great and that it's very easy to fall behind the leading edge. Whoever we are working in this area, it's entirely possible to just frankly lose connection with the kind of opportunities that exist. We have just got to make sure that our training and our education is at that leading edge and stays at that leading edge. It's an interesting question as to ask how that could happen. So what have I learned? I've learned we need to be people-centric. We've got a set of principles that will create a great conversation, I hope, in every office, in every environment in which we try to build great technology for care and support of people as they get older, and of course, within the vulnerable community. The second thing is we've learned some wonderful best practice that I'm encouraging you to read up and apply where you can. And then finally, I think we've got a big opportunity to make sure that everybody's at the leading edge. It's been an absolute pleasure to chair the panel. They've been absolutely fantastic with me. They've made my job easy. The expert witnesses have brought wonderful insights. I couldn't have asked for better support from that whole community. It was quite daunting for me to do this piece of work, but it's been an absolute pleasure. And I'll come back a little bit later on to say a few more words. And of course, access the report at HousingLIN. It's brilliantly written by Lois and Jeremy. It reflects everything that we saw in the panel and discussed in the panel. And so I commend it to you. Right. Now, honestly, you don't want to hear any more from me. You probably need to hear from people who know what they're talking about. So we've got 3 panelists and we've got 3 expert witnesses who are just going to give you a flavour of the kind of work that we've been doing. In fact, really, it's okay, my mum's just put the kettle on. You know, when we did these events, it was all online, and that never makes it too easy. Nevertheless, everybody leaned forward and had a very open discussions about opportunities to make a difference. The 3 panelists I'm going to introduce first. There's about 20 minutes for them, and then there's another 20 minutes for our expert witnesses. Let me introduce the panelists first, and I'll introduce all 3 of them, and then I'll hand over to them. First, Allison Scofield, who is to blame, by the way. She's completely to blame for getting me involved in the whole technology and care area. So if you don't like it, then blame it all on her. Allison is the Chief Executive of the TSA, Tech Services Association, and has been a bit of a mentor for me as I've learned about the way in which technology and care come together in all environments, in all settings. So Allison was on our panel. Secondly, Andy von Bradsky, who's frankly also done a brilliant job of educating me in all aspects of architecture and the way in which housing and care and technology as a sort of triangle need to all come together. Andy was the former head of architecture at MHCLG, and it's wonderful to have him on the panel. And then finally, we have Dr. Gemma Burgess from the University of Cambridge, who, frankly, there's not a lot that she doesn't research in the context. If you look at her website, you'll see that there's this wonderful array of different research areas in the context of housing planning and people. And so it's also brilliant to have her on the panel. So I'm going to hand over to Allison first, then on to Andy, and then on to Gemma to say a few words about what they've thought of TAPPI. Over to you, Allison. Thank you.
Thank you, Roy, and thanks for the great introduction. And I was absolutely delighted when approached by Gemma in the HousingLIN to join this expert reference panel. And it's been so insightful, as you've said, Roy, as he's talking to his mother in the house. My role on the panel, as Roy's explained, is I'm the Chief Exec of the Technology-Enabled Care sector, who represent about 1.8 million people, vulnerable people in our communities. And I've got to say my initial insights were how aligned and relevant and related the TAPPI work was to our sector vision, which is people choosing technology-enabled care to enrich, enhance their everyday lives, and their lives, what we really want to do, change everybody's everyday lives. And putting people at the heart and centre of this inquiry has been a fantastic experience, hearing from users and carers, hearing lots of voices reinforced our decades of work across the health and care sector and the importance housing is in achieving quality outcomes for people in communities. Week by week, as the inquiry heard best practice from construction partners, technology suppliers, to real-life examples how technology is being embedded into service offers. And that's across the UK and further beyond, and making a real difference to people's day-to-day lives, allowing them to live independently, having choice and control, and supporting their overall health and well-being. And we heard from Sue at the beginning that there's been some alignment of works and commissions going on during COVID and over the last, certainly our commission with ADAS, the Association of Directors of Adult Social Care, formed a strategic alliance in September 2020 and published the findings in 2021, which have been referenced in the report. But I've got to say that the key thing for this report was to create a personalised innovation programme across the UK. And housing is at the very heart of this work, and what's always been, in my firm opinion, that the housing needs to be at the table equally with our housing, with our care and our health colleagues when designing services in communities to support the health and well-being of citizens. But most importantly, the people and the citizens and their carers also need to be at that table. And one insight that really resonates with me from the work is from our Danes across the border there. Live your life at home, that's the new, what they're calling their social care movement. That's quite incredible, isn't it? If we're reinforcing that housing is so critical to the overall transformation of health and care. So let me share the key findings and how they're completely aligned to the other work programs that are going on. So firstly, personalisation. We hear a lot about personalisation, and that technology is hugely valuable in the journey to achieving that. But putting the individuals and their carers at the heart and centre, we heard that so clearly from everybody on the TAPPI inquiry. And people must own their own data. How long have we heard that? But what does that really mean? Allowing better decision making for individuals and for professionals. And co-production, as you've heard from Roy and Jeremy and Sue, is absolutely vital. But one thing that and it's my personal view, is don't be dazzled by the kit, the shiny kit. Start with the people and understand their aspirations, their wants, their wishes. Technology must always be the enabler. And people on the call today will have heard me loud and clear, is this Chief Exec of the Technology-Enabled Care sector, technology comes secondary to building really good design services for people. And I think if we look at data, we're data rich, aren't we? We collect lots of things and lots of gadgets, but we're very intelligence poor. And what TAPPI taught us and reinforced was we effectively need to use that data to empower the decision making, not only for professionals, but we need to inform the decision making for the individuals who are receiving the services. There's lots of things around infrastructure. We hear a lot about analog to digital. That's referenced in the report. But let's focus on the digital infrastructure of people, how we must improve individuals receiving the services and our workforce. Such a strong theme throughout TAPPI. Workforce, not just those frontline housing workers, not just those frontline care workers, but our digital leaders, our leaders across housing, so they can be empowered to make this step change that's needed. So giving the professionals, the individuals, toolkits, that was a key theme within TAPPI, knowledge, skills and know-how. It's the know-how that the TAPPI principles will give us all. And collaboration, how we're going to see the collaboration, is valued in the prevention agenda. So, you know, the adult social care had a vision to shape things around individuals, putting power into their hands so they can choose and have control of the support that they want and maintain their own health and well-being. But technology can really enable this, can't it? Empowering families and community networks and ensuring care and support is joined up, preventative, responsive, and tailored to people's needs. Such a line to how, you know, that vision there of TAPPI, of co-produced, co-led, choice-led, interoperable, and we've heard all of the things within the TAPPI report. But I truly believe now, I do believe now, we're stronger together across housing, social care and health, and we're collaborating much better, and we're forming really strong partnerships. But what we've all got and what I'm seeing during COVID and over the last period is we've all got a common purpose. And that common purpose is not technology, the common purpose is people. So I've thoroughly enjoyed it, and thanks everybody for listening today, because this is just the start of an absolutely wonderful experience. And I think the essence of the future TAPPI objectives are just fantastic, and I really can't wait to start that development and implementation. And listen to the rest of the speakers today. It's been an incredible journey, so thank you very much, HousingLIN and Dunhill. Thank you, Roy.
Thanks, Alison. Over to you, Andy.
Thank you very much, and a very good afternoon to everybody. It's a shame we can't see your faces, but it's great to be here online and see so many people interested in this great moment for the work of the panel, the work of HousingLIN, and it's a great time to be celebrating, I guess, the launch of this document. I have to say at the beginning, I'm speaking in a personal capacity as a former head of architecture at what was then called the Ministry of Housing, Communities, Local Government. And you might say also as former chair of PRP, who of course were significant in contributing to the HAPPI report, which came out in 2009. Not from me, but from real experts in that architects group that continue to support HousingLIN and continue to support the work of furthering design quality for housing for older people. In that regard, I'm not speaking on behalf of government, and I'm sure you can understand why I say that. Just a few words from me about 3 Ps, process, policy and product in respect of design quality and technology. You'll see in the report there's quite a significant section around this particular theme, and I just want to sort of say a few words about it. But firstly about the process, and for that I mean the process for producing the report. I have to say it was a privilege to participate in the TAPPI panel. At the time, of course, I was a civil servant, and civil servants rely entirely on experts in the fields of policies they create. So engaging with with this expert group and those we consulted along the way was in itself an inspiration. Learning from those on the coalface, whether it's technologists, manufacturers, designers, care providers, house builders and policymakers. And most importantly, the group that's most affected by all those decisions, consumers of the technologies themselves. Some really impressive best practice examples in action you'll see in the report. The case studies capture what assistive technologies and digital approaches are available now, what their benefits are, and what we expect, what we might expect more of in the future. We really hope that shining a light on these case studies will lead to a scaling up of their use. The second point is about policy. That is from a design and delivery perspective. There's some key messages in the report around use of technology and the digital progress that's being made. Hugely accelerated, of course, by the pandemic, and it's important for government and clients to keep on top of all the implications for policy and design briefs. It's very easy for these things to creep up and not sort of be taken account of until the next time you revise a policy or guidance notes. And just some general points really that I think need bringing out. More needs to be done to embed the latest thinking for homes for an aging population rather generally in planning policy, supporting guidance and in regulation, and that came out through the discussions from experts who gave advice to the panel. More needs to be done to integrate housing design and specification with healthcare considerations at an earlier stage in the design process, and that can only happen through much greater collaboration within the sector, which as Alison said, is already happening, but we need to accelerate that and make more of it. All homes should be more adaptable to the needs of its occupants as they age and as their needs change over time. We really need to future-proof new homes for later adaptation, allowing for the installation of smart technology over time as it progresses and accelerates in its development. And importantly, and it's one that we think is probably subject to another report altogether, in my view, is the strategy for retrofitting existing homes where we possibly can, which of course ties in entirely with the need to upgrade existing homes to meet environmental standards too. Thirdly, the product. The government's Home 2030 features in the report. It was staged by Ministry of Housing, Communities and Local Government last year. Jeremy himself from the HousingLIN was a representative judge, and this particular competition sought solutions for just these issues for inclusive, age-friendly homes. The objective of the competition was to test industry's capacity to deliver new homes that use the latest technology, which includes, of course, smart tech for design, construction and operation. The brief was to plug a gap in the market for multi-generational homes, which are adaptable to the needs of an aging society, that result in healthy outcomes, low environmental impact and deliverable at scale. And of course, we feature within the report examples of modern methods of construction and advanced technologies that enable this revolution in technology to actually happen on sites and in ordinary everyday development. So I would say the TAPPI principles are a cornerstone for those objectives for that competition. To give plenty of advance notice, Sunderland City Council and developer Igloo is hosting a Future Homes Expo in 2023, which will showcase built examples of the winners of that competition and new assisted living environments that apply the TAPPI principles. Perhaps something else for Roy to be looking forward to in Sunderland in the future. Just in summary, a rapidly changing nature of technology and digital applications, really clear benefits to the sector. The report brings that out. It brings out the art of the possible, gives really good practical examples. And you could say it's a new chapter for the HAPPI series, which we know HousingLIN have been promoting admirably over the last few years. I'm sure its recommendations will contribute positively to future policy development in the newly named Housing Department, DULUC, or MLUC, or Ministry of Luck maybe, and the Health and Social Care Department as well. And they should be working together to address some of those really significant implications for an increasingly ageing society. Delighted to have contributed, and thank you very much for hearing me out. Thank you. Over to you.
Thanks, Andy. That's brilliant. I am actually in Sunderland as we speak, and looking forward to the Expo in 2023. Over to you, Gemma.
Thanks very much, Roy, and thank you very much to Jeremy and to colleagues for inviting me to be part of this inquiry. So I'm an academic, and it's always fantastic to have the opportunity to be part of something that is really directly impactful. Not that I'm saying that academic research isn't, but we need these partnerships to make our research have that impact. And this report and framework make a really significant contribution to our understanding of how we might best support people, all of us, as we age. All research shows us that people have a very strong preference to remain in their existing homes as they get older, but those who would like to move to housing that would better meet their needs face shortages of specialised housing, a really quite shocking lack of adapted or adaptable housing, and very little housing choice in the general market. And the pace of change in smart home technology is so much faster than the pace of change we see in the construction and adaptation of the physical homes that we have to meet our needs as we age. So the potential of new technologies and digitalisation of existing forms of support to enable us to live full lives as we age is really considerable. However, technological advances in older people's living environments offer both opportunities and risks. So our research on the provision of smart telecare for older people that was also funded by the Dunhill Medical Trust found that there are 3 goals driving those people who are coordinating the provision of smart telecare: the analogue switch off, a policy agenda centred on preventative care, and the potential for achieving cost efficiencies in care provision. However, we concluded that operational and organisational challenges associated with smart telecare provision can obstruct the goals expressed by service providers. So the technological fix offered by smart telecare is subject to social and political dynamics. In the TAPPI panel discussions and in our research, we've identified that focusing on the technology product itself is not sufficient. We need to take a whole system view. And there's a need for a person-centred approach that involves joined-up thinking and provision across service and practitioner silos. And running through all of this technological advancement is the need to find ways to talk with and about older people and their living environments without falling back on reductive and simplifying categorizations. Rather than starting with the question of what technology is out there and what does it do, how do we find ways to harness the potential benefits of technological advancements whilst also regarding people as individuals with their own aspirations and wishes, and frame technology in the home around this? And we see a lot of goodwill in the development of new technologies, but until now, little guidance on how to connect technology with the people who want it in the most meaningful and effective ways. And the TAPPI principles address this head on. They give us a framework for decision making about technology that puts people and their aspirations at the centre. It doesn't shy away from the reality that technology needs to be cost effective, offer value for money, that it must be good quality, that it must address the preventative agenda. But the TAPPI report and framework goes further than this, and it stresses the need for technology development to be person-centred, to be about choice, and crucially, to be co-produced. I don't think any of us on the panel are going to pretend that this is easy, and there is certainly a lot more to be done to embed such principles in the realities of people's lives, in practitioner norms, and in our systems of support. And just the final but connected point, our research that we've been doing here at the university has also shown the challenges that many different people face as a result of digital exclusion. The benefits of the advancements in technology in care and home environments will not be enjoyed by everyone as long as digital exclusion persists. And the TAPPI principles recognise that we cannot just focus on the technology or even on the digital infrastructure, but we have to focus on empowering digital citizenship, on enhancing digital skills and learning, and on tackling those really quite deeply entrenched digital inequalities. And the report highlights that there is a specific need for the development of digital skills, not necessarily or only for older adults, but also for those who are involved in their lives, including practitioners and those involved in service delivery. So for me, being part of the TAPPI panel, hearing from the witnesses, co-creating these principles has been a hugely rewarding experience. And I think the output is a set of principles that we can all apply to the work that we do. So thank you very much, and back over to you, Roy.
Thanks, Gemma. That's great. You know, the principles, I think, will allow us to embed academic knowledge, insight, and research into practice. And the more we can do that, the more we'll get great value out of the work that you do at Cambridge, but that all universities, often in the regions, are doing in the context of the way in which the older population and the vulnerable population are engaged. There are nuggets of academic research pretty much across the country that we need to be able to pick up, use the principles with, and then turn into practical application. So it's great that you were on the panel. You added huge value. Thank you. And thanks to Allison and Andy for giving us a flavour of what they think the value is in the TAPPI learning and the principles, but equally in giving us a sense of the atmosphere of the panel and its forward-looking nature. So thanks to you all. Now, the panel couldn't have worked without, honestly, some fantastic provocations from people who have technology and its application in a variety of different settings at heart. And so we're now just going to listen to a few minutes from three of our expert witnesses to the panel. We're going to start with Claire Morris from Rethink. And Claire really had a fantastic impact certainly on me, because she brought to the conversation something which I'm going to point out now. It's on page 13 of the report, right? These are 12 insights from some work that they did in Essex, that Rethink did in Essex, which it's really important for us all to be reminded of what older people really say about their own capabilities. And you can knock down a few preconceptions really easily by reading page 13 of the report. So Claire, it's great to have you. In addition, what can I say about Clinton Farquharson? Well, he was our first expert witness, and I was a bit nervous in this process, but he made me feel very relaxed. And he said something right at the beginning that I'll never forget. People want a life, not a service. And in fact, they want to be identified as if they're leading an ordinary life and not one which is surrounded, and there are boundary conditions around their health, and often they're not bad, but they're not bounded by their care needs. And Clinton was just fantastic in bringing that to bear very, very early in the panel. And then finally, we've got Geraldine Begg, and thanks, Geraldine, for involving yourself with us from Scotland. There is already, I live in Scotland, so there is already in Scotland some very important integrated thinking, in my opinion, and I think the opinion of the panel, particularly in the context of the tech charter, with the 7 commitments that are being made there. And I encourage everybody who's on this call just to take a quick look at what's happening in that context. And so, Geraldine, it's great to have you on the call too, to say a few words. So I'm going to hand first to Claire, then to Clinton, then to Geraldine. And thanks, guys, for taking time out this afternoon. Over to you, Claire.
Lovely. Thanks, Roy, and good afternoon, everybody. I'm Claire Morris from Rethink Partners, and it was an absolute pleasure to be asked to be witness for the TAPPI Commission and its work, which is hugely important. So at Rethink, we are thinkers, influencers, but we are mostly doers. We like to get things done in this space. And we are a health and care transformation agency, but over the last 3 years, we've done lots of work with councils and with national bodies trying to get technology out into people's homes and in their lives. Everything that everyone has said today already and the TAPPI framework completely resonate with our experience of working at the grubby front line of this work. And we can think about digital inclusion, policy, finance, all of those drivers. But for us, we are really privileged to work with some pioneers in local councils who are really trying hard to make this stuff fly at the front line, because they know how life-changing it can be for people when we get it right. We are also working with the LGA, and we're just beginning a third series of support, national support to the sector, funded by the Local Government Association and NHSX. And I will unashamedly put a link to that programme in the chat shortly, because we will be running 5 masterclasses for councils over from December through to March to pick apart some of the stuff that many of you will be grappling with in terms of how you get great technology through the complexity of governance, workforce, you influence social workers, care professionals, NHS partners, and get it out and used and loved into people's homes. This is a very complicated agenda, and our work is a microcosm of that complexity. But the thing that kind of I think is essential to how we navigate through this is actually, and the thing we spend a lot of time doing is trying to influence culture, and that means influencing people. We try to connect with people's passion, their enthusiasm, what made them join their profession in the first place, because this is a marathon, not a sprint, and this really stimulates their commitment. So I am going to share with you a video that we have made in partnership with Suffolk County Council who we're working with at the moment. They are just embarking on a really ambitious digital care programme for older people and adults with social care needs across Suffolk. And we produced this trailer, unashamedly, it's a movie trailer for technology, to really motivate frontline staff and partners to want to get on board with this agenda. So fingers crossed that the technology works now. If you could show the video, please, Jerome.
This ball here, this makes it easy for my daughter to know exactly where I am in the house. It doesn't show me, but it just shows my movements.
Morning, Kitty. Just doing your welfare check. How are you this morning?
I'm very well, thank you. I'm getting better every day.
The main benefit of having the technology is that if you're living as a carer with your relative, you can go out and about more and feel more relaxed and comfortable about what you're doing. He can get around by himself, turn lights on and off if he wants to go to the toilet.
Alexa, bedroom light on.
Okay. And if he has a fall, hopefully he will be in reach of one of the panic buttons, so that I can be called, or if I'm not available, then an emergency call put through.
Every morning I get a vibration on my wrist just after 8 o'clock, and then I just press one button here to let them know that I'm okay.
The main thing is the heart nurse, Hayley. She can see me and she instantly knows whether I look better or worse. Oh, it makes me feel great.
You actually get to see someone, you know, and it's not just a voice, it's a face as well.
It's such a weight off our mind knowing that we can contact Ian whenever we want to check on him, which is good for his well-being as well as ours.
It is a bit of company having an Alexa.
Oh, it is utterly and completely the reason I can be independent.
Thanks, Jerome. And I hope you noted the consumer focus on that. That it does not look like a council service, and we have done that intentionally. So I kind of don't really need to say any more other than just to leave you with that video. But we are ambitious, hugely ambitious for older people and giving them access to technology. And we want the organisations and all of us on this call to be that ambitious too. Technology needs a democratising approach to be taken up, but it is hugely democratising in and of itself. And that is our passion. Thank you.
That's fantastic, Claire. That was an inspirational video, and Rethink is doing some inspirational work. It's just great to hear. Can I just add something? A few weeks ago, I was sitting in my kitchen doing some work, and I got a call from my mother on FaceTime. And I said, what's the problem? And she said, oh, it's nothing. I was just dusting this thing. And it came on. So there's an example for you. Anyway, I'm going to hand over now to Clinton, and with pleasure. Clinton, over to you.
Thank you, Roy. Good afternoon, everybody. Thank you for inviting me to speak today. It seems a while since I spoke to the inquiry in January, and it is good that after such a lot of work, the report is now ready. Thanks to all of you that have been involved in it. And I have had a sneaky preview, and there are a few areas that I would highlight from the perspective of personalisation and in my capacity as chair of Think Local at Personal. First off, I'm really pleased that the message came across loud and clear that the development and use of technology must be anchored in the lives of people. The starting point should always be the person, their aspirations, their needs, their home setting, and the circle of support. This is the opportunity of build it and they will come. Much as I admire Kevin Costner, it is simple. It's a simple point, but absolutely necessary to keep saying it. Technology has the power to change people's lives for the better, but only if this is done in partnership with people. Secondly, when I spoke back in January, I talked about the importance of technology in the relationship of some A's. First, avoiding assumptions, but this I mean that expanding the use of technology should not be driven by misplaced beliefs that older people don't use tech and all disabled people are tech savvy. The real picture is, as we know, far more complex. There are some encouraging signs that COVID and the pandemic has led to a reduction in the number of households without access to internet, and some increase in the take-up of technology by older people. I expect some of you will have personal experience of helping older relatives get to grips with Zoom or other virtual means to stay in touch at this very difficult time. I can confirm that my mum has made more use of tech during COVID. Mine is part of the family Zoom and WhatsApp group. It has been joyous at times as a family watching my mum struggle with the camera positioning and sometimes just seeing the ceiling or up my mum's nose. But there is further work to do here, and we must make sure that the digital gap doesn't worsen. So accessibility and affordability remain important issues. And for me, this means regardless of whether someone is paying for themselves or the council or other public bodies is funding, People need access to reliable and impartial information, whether for technology-enabled care or commercial produce available on the open market. This brings me to the issue of policy. As I spoke these words, people in government are beavering away on a white paper on social care reform, due in just a few weeks now. There is also the white paper on integration, expected at more or less the same time. And I think it's reasonable expectation that both will lean heavily on accelerating the use of technology to address current problems. That's fine, and I would expect to see that. But, and it's a big but, technology should not be seen as a quick fix or a panacea. That's why the work of TAPPI is so important. And I welcome the idea of having 10 principles to guide the future development of technology amid, aimed at older people. I'm confident that there will be much read across to the experience and needs of disabled people of working age. This development needs to be evidence-based, using people's stories backed by research and hard numbers where these count. The report contains many important and practical recommendations that can and should be acted on to shape policy, and that all-important substantial stage of detailed design and implementation, at the heart of which should be older people and their families. With TAPPI in our back pocket for easy reference, we should be able to move forward towards a future where more and more of us embrace technology as a key enabler that supports people to lead better lives. And thank you for listening.
Fantastic, Clinton. I mean, always inspirational. Certainly for me, you're an inspiration, and you make some really important points. I also think that the TAPPI value is policy down and movement up. We can all use these principles from tomorrow, in my opinion. I think what that allows us to do then is to have a vocabulary which is pretty easy for policymakers to understand. It's person-centric, it's for the individual and their families, and let's not forget their families. And that allows us to have a conversation with a vocabulary that policymakers can relate to. This is a big opportunity. So it's great that you make those points. You reminded me of something I should have said earlier. So that's great. Thanks so much, and thanks for playing a part. I'm going to hand over now to Geraldine, and over to you, Geraldine. Thanks.
Thanks, Roy, and thanks very much, Jeremy and Lewis, for involving us up here in Scotland in the report. Yeah, so I'm the Tech and Housing lead. I'm up in Scottish Federation of Housing Associations, but my role as lead goes across local authorities and housing associations, because it's all about all of us working together, and that's been so beautifully apparent through all of the stuff that's happening in TAPPI, and it's been resonated so many times on this today about that absolute critical nature of working together, doing things in a co-designed way, having people at the absolute heart of everything that's being done. And though, like Allison said, technology is so important, it's the enabler. It's what's important to people comes first. And we've been very fortunate up here in Scotland because we have had the technology-enabled care in the technology-enabled care programme through our Scottish Government up here, which is based in our Digital Health and Care Directorate. And it has been really looking at various different ways of using citizen-facing devices and digital solutions to be able to support housing, health and social care. Housing came a little bit later into it, so our program's been running for maybe 4 years. But as Roy said, we have a charter developed and it's 7 principles. I'll put a wee link in, but you'll see it in the report when you're reading through your report anyhow. But we thought that the principles and the recommendations coming through TAPPI are so what we've been experiencing up here, and so the focus that we're thinking of. Things like preventative opportunities, and within the housing sector and with, you know, care and support, unbelievably, you know, there's so many opportunities. One of the pieces of work we're doing at the minute is about healthier homes, healthier people, and that is absolutely embracing the Scottish approach to services design, which is putting tenants and customers right at the beginning, saying what's important to you about your heat and your home and your health. What does it mean to you? What are the challenges? What would you like to see happen? And then from there, start to consider, okay, how can technology support with that? Because a warm, dry, affordable home, that's where it all begins. And you'll all know the number of times that maybe things have been put in when people are coming out of hospital only for them to go back in because we haven't considered the home and the home environment. And so many ways technology can support. One of the other things you were talking about there was, and that comes through TAPPI really strongly, is about the access to skills and knowledge. And we've got tech and housing rooted within the tech programme, funded by the tech programme, has a huge big infrastructure around it within Scotland, which we're finding is really quite critical to all of this. And in amongst it, we have a number of organisations that are supporting with digital skills. So we have, for example, a huge programme of work called Connecting Scotland, the aim to get everybody with a device and digital connectivity and the skills in order to be able to use that. And so we've got digital champion programs that are going on for housing staff. We have resources there for tenants and customers to be able to use and to upskill. And, you know, again, it's making sure that housing is absolutely embedded into the development of all of those training and learning. It's not an add-on, it's health, housing, care, all working together, which is something we find so important. Another thing that we've been looking at quite strongly up here, and we've been talking about interoperability and about the opportunities for digital telecare and that whole move from analogue to digital. And again, it's about making sure that we're listening, first of all, about what's important, not just looking at what's shiny or what's happened to appear across your desk. And so we find that funding is quite important for this, to be able to support some of this work, to free up other people's time, to have that meaningful engagement, because to do true customer design takes longer than just finding something and implementing it and then hoping for the best. So we've been really, really delighted to be part of this whole project and this programme, and to be able to share the learning. We know we'll have so much to learn from what comes next, and we'll be able to share more of our experiences. But I'm aware that we're running over a little bit, so I'll stop there, and yeah, I'll put my contact details and stuff in if people want to hear more about what's happening up here.
Thanks, Geraldine. It's great to have you involved. And one of the things that in my previous life in business was very obvious to me was that we needed a community of practice in order to share and reapply things that were going on across our world of business. I really think that in the context of technology and its use in housing settings and in care settings, we really do need to build that community of practice in a national and international way, almost as a sort of hub. There needs to be some form of hub in order to enhance collaboration. So thanks for that, and I'm sure people will be typing in Scotland, Federation of Housing Associations and having a look at what you've just been talking about. So thanks, everyone. Back to me now. And what I want to do is just take a few minutes to answer any hot questions that are within the community that's listening in. And there are a couple that I've identified, that I've seen, that can be that maybe we could start with. And the first one is a how question, because we constantly, in many areas of our lives, understand what the problems are, but we often struggle to bring to bear solutions. So the question, and it's an anonymous question, how can we better encourage collaboration? And that's cross-sector and within sector. So is anybody on the panel and in the expert group wish to just take that big question on? Somebody say something. Any of you? Julia, thank you.
Thanks. I think just start somewhere small. I think it's too big a task to try and solve all the problems of all the world. I think find somebody locally, find a partner, find your customer, and just start somewhere and start collaborating, and then hopefully that will build. We can collaborate a bit more. Just find a willing party. Start with success, I would say.
Yeah. Geraldine, do you want to add to that? Thanks.
Yeah, I was just going to say, totally agree, Julia, and then share the successes. You know, that I find even just the other day, it was a lovely story, lovely story about a lady who just got a light writer on her iPad, and the housing provider was providing, you know, had Wi-Fi enabled within her home, and they had enough digital skills to be thinking, this lassie loves her music and can he access it? And so they suggested she buys the thing that I'm not going to say because it'll all wake up everything in everybody's homes, but that voice assistant. And this lady who, you know, is now able to play all her music and everything because of that collaboration between something delivered by health, something delivered by housing, something that the person delivered themselves. And see, even just getting that message out, see the number of people who have since come back and gone, oh, we could do that actually. We could do that because we already have them things, you know, and it just snowballs, doesn't it? So yeah, I was just going to mention that.
Yeah, fantastic. Thank you. Claire.
Just two quick things, and I think that's building beautifully on what's just been said, but whether we think they are a patient, a tenant, a relative, a service user, the person at the heart of this is the thing that unifies all of us. That's who we are trying to serve. And of course, they are none of those things. They are a person. But the more we can focus on them as the unifying principle, the more successful we will be, and not using some of those terms. And then a kind of more technical thing, but I think we are so siloed in how we do this work. And the more we can nurture people who have got cross-sector experience, who've worked in councils, but also worked in suppliers, who've worked in academia, who've worked in the private sector, those people are incredibly rare. And it would be really interesting, I think, particularly for people leading this work in councils, and how they could get safe exposure, particularly to the market, but to other parts of the sector. I think that would be a fascinating thing to explore, because you won't understand each other's worlds and collaborate more effectively until you've actually stood in them.
Yeah, that's a great point. Andy.
Yeah, I'm just having worked in government, just in terms of collaboration there, various departments have gone through a rather torrid time during the pandemic, with the NHS and DHSC really focusing very hard on dealing with that. And at the time that happened, there was an awful lot of exchange between the various departments on these sort of issues, between, you know, the health, the housing and the technology aspects. So BEIS DHSC and Ministry of Housing really working quite closely together, hence the Home 2030 coming forward. I think there's a need now to regroup amongst civil servants to actually bring together some of those collaborative approaches so that some of these things are sort of understood across departments. And very often that silo approach reflects that it was just talked about is reflected in government as well. I don't think they mind me saying that, I'm sure, but there needs to be something that brings all these issues together at the very top, as well as at ground level, and that collaborative approach needs to run right through the whole agenda.
Yeah, okay, thanks, Andy. Allison, I know that you've been thinking about this for years.
Yeah, thanks, Roy. And I think one of my things would be about two partnerships and collaboration in communities, and where you see that's really good. We've heard loud and clear there from Claire and Geraldine and others. And people has to be at the focus of it. But to get true collaboration, we've got to look at the outcomes across everybody. What's in it for me? The user, the carer, the professional, the aligned professionals. And if there's common goals and common purpose, then define what good looks like for each of those audiences, bringing them together. That's where you see true collaboration starting to form. And we've seen it, haven't we, in COVID, where Hampshire, this one, that one, great examples in Scotland. It's where to get that right. So there's common purpose, but also what's in it for me as a housing professional, a health professional, social care, not all benefit in one or the other. So that would be my big ask coming out of TAPPI.
Thanks, Alison. It's a remarkable thing, by the way, that implicit in much of this is preconception with respect to what older and vulnerable people are capable of, and we're going to have to break down those preconceptions. And we can do that. We can only do that together, and that's why collaboration is so absolutely crucial. Thanks for the various insights on that subject. There are a couple of points, by the way, in the Q&As. Ali makes the point that that 1 in 5 UK households had a smart speaker at the end of June 2019. That number will, of course, increase significantly, and yet not that many people who have those smart speakers will be using them to support health and care. There's a very interesting question of education, training, and opportunity that we still just need to get to grips with somehow. Emma's asking the question: do we have a list of good practice case studies, initiatives, tech examples that can be shared or they can be pointed to? Anybody want to just deal with that? Because it is part of what TAPPI in the end is intended to be able to, is intending to do. It's to bring that together. Anybody want to just, Jeremy? Yeah.
Just to quickly come in, I mean, the report itself draws on over 30 very clear examples, and you know there are a whole host more out there which we've picked up, published since we wrote the report as well. So this is a constantly evolving sector, but I think, you know, the LIN does want to pull together and curate a technology, housing and technology webpage. I think Sally's just posted it in the chat box. If there are examples that you're thinking, we want to work collaboratively, using that word, with others to collate and curate this so that anybody, including people who benefit directly from the use, you know, can benefit from getting access to good quality information.
Yeah, how good would that be? Claire?
This is not ours, but just a quick shout out. The Local Government Association run a closed knowledge hub network for councils, and that councils put their own content on it as well. It's I'm not part of it, it's a completely closed community, but I know Hannah would want that flagged, and she's already put the email for the LGA contact in there. There she goes again. And we at Rethink Partners, we've got a resource centre. We're constantly updating it with ours and others' content. So I put that on our website. But we all could do better at joining that up as well, couldn't we?
Brilliant, Claire, and thanks for that. I want to ask a question which is in the chat and not in the Q&As, and it's from Joe Garston in Manchester. And this is an interesting question of adoption and risk. And I'll just read it. In Greater Manchester, we're trying to understand the extent of wider digital exclusion issues around older people struggling to use digital household appliances, including TVs, washing machines, and heating systems. We've heard of older people getting their cleaners to come in and turn on washing machines with digital displays. Others have been unable to turn their digital heating system off in hot weather. These are issues which can have a significant negative impact on older people's ability to live independently. And by the way, their feeling of comfort with technology. Would be interested in understanding if areas are seeing these issues and how they're supporting older people in this respect. Anybody got any insight and thought on that subject? We all think that technology is going to be a good thing, but if there's an issue that happens, then that can knock down that whole building, if you like, of great news. Hannah, over to you.
Yeah, so I have to say, I don't. The question was, do we have any examples? I don't have any examples. We can ask around from councils for you if you wanted to get in touch with us afterwards. But I think for me, that's a really good example, maybe where tech is being put in and it's not being discussed properly with the person, because actually we shouldn't be putting in any form of tech, whether it's just a dishwasher or whether it's a high-tech care piece of equipment. We shouldn't be putting anything in without really having consulted and engaged with those individuals. So I think for me, there's probably something about who's buying those pieces of equipment for people. And, if it's not done with that person, then of course you're going to have issues with that. So that would just be my bit of, I think it's a prime example where we're not putting the person in the centre. Yeah,
that's a great point. Claire.
Sorry, I will stop talking. But Roy, you gave a shout out for the research we did in Essex, and it's in the report, but there were two standout things for that. So one was older people tend to want simple written instructions. That was a really clear, we get an iPhone and you take it out of the box and there's nothing there. That is befuddling to older people. Frankly, it's befuddling to me as well. So just simple things like, and in the Cassia service that we showed you earlier with Suffolk, we are paying quite a lot of attention to leaving bits of paper with people so that they have got a simple guide to how to use the technology. And the other thing was the friendly neighbour or the technologically knowledgeable person in their neighbourhood, whoever that is, who can pop round and help. A friend's son of my mum and dad's friend is constantly going around and fixing their smart TV because they knock it off all the time. So how we connect people with that network of community volunteers so that, you're never going to phone a helpline for that, but just basic, really practical support, how to change a cartridge in a printer. We need those neighbourhood people to do that work.
Yeah, Mike O'Hara on the chat says technology through a trusted face is vital. What a great point. I love some of these really sharp commentaries on what we have to achieve, and we have to achieve trust as well as practical benefit. This is actually, there are two things to this. There's function, and there's the head, and there's the heart, and we've got to get to both. Otherwise, people simply will not adopt the kind of technology that we think is frankly obvious. I think that's a great point, Claire. Now, have I got anything else that Jeremy, is there anything else? Oh yes, just one thing. We did have Wilhelmina Hoffman on our panel from Sweden, and I'm going to encourage you to take a look at the organization that she leads in Sweden, which is bringing to bear in the housing sector novelty with respect to technology and its use. And she's working quite a significant degree with Kaye in order to do that. you should just take a special look at that, because that was an international example of best practice that we thought was very important in the panel. Right, well, I'm going to draw this to a close now. There are, in fact, quite a number of more questions that we won't address, but which we hope to continue a conversation on. The chat itself, by the way, has been extremely valuable from the point of view of directing people to and signposting people to new material that might be useful in anybody's work. So I'm encouraging you to take a look at that chat. And what I'm going to do now is just move on to what are our next steps. And Sue, Allison, and Lois are going to say a few words in that, with respect to that. So Sue, can I ask you to just take over now for a minute or two?
Of course, thanks, Roy. We never planned for this report to be an end in itself. To quote somebody more eminent than I, this is the end of the beginning. So in my introduction, I mentioned the importance of ownership and practical action, and we talked consistently about the need for collaboration. So we now want to draw on the array of practical skills and experience and know-how that we've identified during this first phase to really test and refine these principles to create a really truly person-centered and place-based interventions that use technology well and as an enabler to integrate housing, health and social care to help people live their best lives. We're just starting to have conversations now about defining what this next stage looks like in more detail. But what we want to do is to create a robust and usable framework. And we're really keen to support that development. But we don't want this to be a hands-off and theoretical process. We want to base the framework on best practice, and in particular, how it will work with the reality of people's lives. We want to facilitate the scale and spread of best practice in technology-enabled care and integrated working. And we want to collect the evidence from a whole series of testing and piloting to firm up that framework and its underpinning principles. We really want to get into addressing the how, which is what Claire was talking about. I think there's another piece to this as well that Roy touched on, because I think it's really important, is the education and training of people. It's not just the skills of the users. Actually, one of the things that we heard quite a number of times during the evidence gathering process was education and training of the professionals involved in delivering person-centered care and an integrated approach. Those skills are key and they need investment and development as well. So to go back to what next and that definition, rather than me try and stumble my way through painting a picture, I'm going to hand over to Allison, who's going to talk to you a bit about the sorts of things that we want to do next.
Thank you. Thank you. This is the exciting part, isn't it? We've got a great TAPPI principle report and we've heard from everybody, but it's how do you turn that into reality? And we heard from Claire and some of the work they're doing with LGA. It's absolutely critical that we take it and we test it in a community environment. So not a pilot, not a small scale piece of work, but how can we go into a community linked to housing, our social care colleagues, and do the enablers that we all know are so desperately needed. So mirroring a piece of work that is in a community or a couple of communities where you start to take that progression of need of an individual and get them back into enabling, preventing and enhancing. What are the foundations and the enablers that you need to achieve that? And our colleagues on the call today have heard lots of work that's been going on in the sector with our colleagues in LGA and ADAS about what are those foundations that systems will need, those key enablers of workforce interoperability. What are the key strands of those enablers that would embed into the framework and then build the key criteria for the built on evidence And it's always the evidence-based bit that we don't quite get right. So I'm really excited. You've got some great people on this TAPPI, Sue, to work with. And if we all work together on how we could take something out in real time into a community, test it, and bring those enablers and those foundations as core principles of embedding the detail in the TAPPI framework. It's quite an exciting journey for us to be on, Sue.
It absolutely is. I'm really looking forward to the next phase. As I say, this is just the end of the beginning. We can't stop now.
So brilliant, brilliant, brilliant.
Last but not least, I'm going to hand over to Lois now, who honestly has been an absolute rock in producing this report and frankly bringing things together. We had an awful lot of material. We had some fantastic case studies. And it just wouldn't be as interesting and hard-hitting and valuable without the contribution that Lois has made. And so over to you, Lois, to tell us a little bit more.
Thank you, Roy. And yeah, thank you. I just wanted to first also just start by saying, you know, it was really, for me, it was an absolute privilege to be the secretariat for this inquiry and to be surrounded by such great thinkers and such great minds that really made my job a lot easier. So thank you. And as the youngest person on the panel, in the back of my mind was always, you know, how can people from my generation benefit from the results of TAPPI in the years to come as, you know, technology becomes even more entrenched into our daily lives. And I saw, you know, another comment in the Q&A boxes around kind of the millennials and the impact that they might have in this space. So as you know, as you've already said, from the start of the project, really, it was very clear this is a very vast and complex subject matter, which, you know, we've decided would really benefit from a TAPPI framework that creates a comprehensive strategy which will support us all to embrace technology and understand its potential to enabling us all to live independent, happy and healthy lives. But what particularly came through the inquiry was that a future TAPPI framework needs to address a whole host of things which are all interconnected, from, you know, how we create homes that are adaptable and digitally enabled, to what digital apps and tools we can use to support our daily lives, as well as the need to champion digital citizenship, particularly in the light of COVID, which has exposed many digital inequalities. But what came across strongest, and I think what, you know, many people have already mentioned, is the need for a framework that's driven by and co-produced with people. And I'm hopeful that the next steps that Sue and Allison have mentioned will enable real life testing of the TAPPI principles from the point of view of real people. And if all of those things can work together, I think we can really enable people to live better for longer. And so in the meantime, I hope that you can all think about applying the TAPPI principles in your kind of daily lives towards digital transformation. Thank you. Back to you, Roy.
Thanks, Lois. And that's all you're going to hear from me. And I'll just hand over to Jeremy to close out now. Thanks.
Well, I think everybody can agree that's been a really fabulous launch event. And can I just thank everybody who's both contributed today, giving their insights, their wisdom and recommendations, but also everybody behind the scenes who's made the launch event today possible. The team behind the scenes, you know, both from everybody from who produced the report right through to designing and formatting. But I think we've got a standout document, and really, as Lois said, we need to make sure we embed that going forward. It's available on the HousingLIN website, and as Roy mentioned earlier, you know, it's gone viral today on Twitter sphere as well. This has been our penultimate happy hour of our autumn series. If you found this an interesting subject matter and you want to find out more, please join us at future happy hours. Next week, we're doing a little bit more of a spotlight on seeing what are the sort of triggers for people wanting to move on or move in. So again, some of that debate around right sizing or downsizing, very much building on some of the work that's done through home improvement agencies, through housing associations, local authorities and the private sector to stimulate a better market for later life housing. So do join us at our happy hour next week. And if you want to know a bit more about where TAPPI is going forward, I'm really delighted that Sue from Dunhill is going to chair our session at the HousingLIN Summit. More details out this Thursday, and we've got a summit looking at issues on technology, and a number of the speakers will build on their contributions today. So a very, very warm welcome to all of you for our summit in December. But for now, thanks very much for joining us, and I wish you a great celebratory evening for everybody who's contributed and listened this afternoon. Bye from me.